Cassie said, my name is Michelle Overbye. I'm a family nurse practitioner. I've been at Grand Itasca since April. I grew up in North Carolina and I moved here kind of when I was a late teenager. So yeah, I'm married. My husband works at U.S. Steel in Mountain Iron and I have a 3-year-old daughter. And then we're expecting number 2 in December. So
Oh my gosh.
yeah, busy. So we're talking about the prevention and management of diabetes. What we'll discuss today is what is diabetes, the prevalence of it, how to diagnose it, risk factors, symptoms, prevention, management. So diabetes, essentially our body isn't using the glucose that we're taking in like it should be. So whether your body's not making enough insulin or it's not using it appropriately to help with the glucose, kind of determines what kind of diabetes you have. So lack of insulin causes the glucose or sugars to build up in your blood system, and then you experience the symptoms, which over time can cause lots of problems. So you can see this number, it's kind of a lot. I'm sure all of us in here personally or know somebody who has diabetes. So 10.5% of the adult population in Minnesota has diabetes, which is basically 1 out of 10 people. It's kind of a lot. And then 35% of the adult population has prediabetes, which is even more important because if you have prediabetes, we can kind of prevent you from having the full-fledged diabetes, or at least delay the progression of it. So different types of diabetes is the prediabetes, type 1 diabetes, type 2 diabetes, and then gestational diabetes. Type 1 diabetes and gestational diabetes are kind of more specialized. Type 1's an autoimmune onset, and then gestational just happens with pregnancy. So today we're just going to talk about the prediabetes and the type 2 diabetes. So prediabetes, if we don't do the prevention, which is healthy lifestyle changes, then it will progress to type 2 diabetes. It can cause all sorts of health effects, heart, blood vessel, nerves, eyes, and kidneys. Then type 2 diabetes is chronic, it's ongoing. A lot of times you hear people trying to find a cure for it, but once you have it, it's really just making sure we're managing it to prevent complications. It can damage if it's not well controlled, your eyes, your kidneys, your nerves, your blood vessels. And having type 2 diabetes is an increased risk for heart disease. So diagnosing diabetes, if you go in and you have symptoms, your doctor might run some of these tests. Sometimes you're there for a completely different reason and they do a lab test and they might notice you have an elevated blood sugar level. So A1C, that kind of gives us an estimate of what your blood sugar has been over a 3-month period of time. In healthy people, it should be below 5.6. They consider prediabetes 5.7 to 6.4. And then once you get to 6.5 or higher, you're considered to have type 2 diabetes. And then another way that it can be tested is by seeing if you haven't eaten and they do blood work, your blood sugar should be 99 or lower in a healthy person. If you have prediabetes, haven't eaten that morning and you get lab work done, and your blood sugar is 100 to 126, they consider that prediabetes. And then if you haven't eaten and you have lab work done and your blood sugar is 126 or higher, that can kind of indicate type 2 diabetes. And then they might do an A1C, or they might just do another fasting blood sugar. We don't usually do the oral glucose tolerance test, which you see over there. That's more used in gestational diabetes, so when you're pregnant and you have to go in and drink the sugary drink, that's what that's usually more used for. So some risk factors for diabetes: family history. Being overweight is huge. Being over the age of 45, having a sedentary lifestyle, not really being physically active, having high blood pressure, elevated cholesterol. Women, if you had during pregnancy a history of gestational diabetes, it does increase your risk later in life for type 2 diabetes. Again, for women, if you've had polycystic ovary syndrome, as a younger woman, had trouble with fertility and stuff, that can increase your risk for type 2 diabetes. And then there is a higher prevalence in different races, so African Americans, Asian Americans, Hispanics, Native Americans. And then if you've had a history of heart disease or stroke, you're at more risk for diabetes. Some symptoms of diabetes, I think the most common are usually very, very thirsty, very hungry, and then peeing a lot. Some people then start to have unexplained weight loss, fatigue, and then they kind of start to have the numbness or tingling in their feet if they don't go in when they kind of have those initial symptoms. They might start getting sores that don't heal, vision changes. But I think the most common that people experience as an initial symptom are like excessive hunger, excessive thirst, and then peeing more often. Most important thing for diabetes is prevention, and that includes healthy diet, losing weight if indicated, and then just being active. So we'll talk about each one. Essentially eating healthy, smaller portion sizes, probably why it's so prevalent in America compared to other countries, because we like to eat larger portion sizes. Eating more foods that are plant-based, and then some people, you know, when they have diabetes, they think they can't eat any grains, but you can. You just got to make sure you're eating the right serving size of whole grains, fruits, vegetables, protein, dairy. And then weight loss, maintaining a healthy weight and then losing weight to get to a healthy weight is important. So one of the statistics they have here is you may be able to prevent or delay diabetes by losing 5 to 7% of your starting weight, because most people who are diagnosed are overweight at the time they're diagnosed. And then the third thing is just being active. So the recommendation is getting 150 minutes of physical activity every week, which is about 30 minutes, 5 days a week. And that 30 minutes doesn't have to be all at once. It could be 2 15-minute walks a day, 3 10-minute walks a day. Again, most people being diagnosed with diabetes aren't or haven't been very active, so kind of starting out slow and working up is better than doing nothing. Doing strength training is really important, especially for women as we age, to help prevent osteoporosis, and then it helps with diabetes as well. And then, if you have a job where you're sitting behind a desk, just getting up, they say, every 30 minutes, whether it's to walk and fill up your water bottle or walk to the bathroom, just getting up and moving can help. So, of course, the recommendation is anyone who has symptoms should go in and see their provider and, discuss your symptoms you're having and be tested for diabetes. If you know you have risk factors for diabetes, family history or weight, then talking to your doctor about getting tested is also recommended. And then it kind of tells you it's just a blood draw. And what we usually check for is either your A1C or your fasting glucose, so it tells us what your blood sugar level is. So management of diabetes, healthy eating, being active, we've kind of talked about those things. Monitoring your sugar levels, taking medication, problem solving, reducing risk, and then healthy coping. So for healthy eating, we've kind of already talked about this one. One thing we often recommend to people is to use something like the My Plate Planner, which shows you what a serving size is. It actually, gives you a visual for that. Another one that a lot of people use and like is MyFitnessPal. So you can scan a label, and it tells you, how much sugar, how many carbs, just kind of the whole nutrition label can load into it, and you can put your serving size, and it keeps track of, so you can have a daily log of what you're eating. And then again, being active. Same thing. And then once you're diagnosed with diabetes or prediabetes, it is recommended to do regular monitoring of your blood sugar, because that kind of gives you important information to how your plan with your doctor is working, how your body's responding to different foods. And then as far as medications go, for type 2 diabetes, and depending on if you have issues with your kidneys or your heart, it's kind of will go based by your history and what's going on with you, but there's kind of common medications we use for it. And those just help control your blood sugar. If you have blood pressure issues, you might have to take medication to control your blood pressure, cholesterol, just because once you get diabetes, if you already have those issues, it can make them worse, and kind of vice versa, the risk for complications. And then as far as problem solving, basically just kind of thinking ahead for what your day is going to be, packing a lunch with, how much carbs, proteins, kind of making sure that you're balancing your meals for the day and your snacks, planning when you're going to monitor your blood sugar, which is typically before meals, and then planning ahead of time, when you're going to do your physical activity, in the morning, after work, at lunchtime. Some important things you can do to reduce your risk once you have diabetes, to reduce risk of heart disease complications. Not smoking is huge. Making sure that you follow up with your doctor regularly to go over your diabetes plan. Once you have diabetes, your risk for eye complications is increased, so seeing an eye doctor annually is important. Seeing the dentist every 6 months, doing foot checks, making sure you're wearing shoes and not out walking barefoot, because your risk of having sores on your foot, or if you get a cut, the risk of it, having delayed healing is increased. And then listening to your body. If you're not feeling well, you feel like your sugars are high, and you're checking them and they're high, just kind of following up with your doctor. And then the last thing, healthy coping, making sure that you're coping with stress. Being active can help with that. Participating in church groups, diabetes groups, staying active in hobbies, and then they put the support group here that Grand Itasca. And the YMCA has the fourth Thursday of the month. The diabetes educator and the nutritionist, I think, are the ones who kind of run this group. So, diabetes is a condition that must be taken seriously. If you have prediabetes or diabetes, your doctor has probably told you that. Making healthy lifestyle choices, the eating and the activity, are essential in helping manage prediabetes and type 2 diabetes and to help prevent complications. And then there's no cure for type 2 diabetes. It's a chronic condition that we manage to reduce complications, but you can successfully manage type 2 diabetes following kind of those 7 things we went through. All right.
Thank you.
Yes.